Ladies and gentlemen, brace yourselves for a journey into the enigmatic realms of the human body, where mysteries lurk within. Today, we unravel a truly perplexing phenomenon that will make your spine tingle with curiosity. But before we delve into this fascinating enigma, make sure to hit that subscribe button, because the world of science is filled with wonders waiting to be discovered. Now, let us embark on our mysterious quest. In our first enigmatic case, we encounter a 12-year-old boy who visited the otolaryngology clinic, accompanied by his mother. What brought them there was a puzzling whitish mass that had taken up residence in the boy's right nasal cavity for the last 5 months. Remarkably, the boy remained asymptomatic throughout this period, with no complaints of pain, nasal discharge, nasal obstruction, or epistaxis. At first, his mother assumed it was a foreign body lodged in his nose, but when the mass persisted, her concern grew. Upon examination, the medical team discovered a scar on the boy's upper lip, indicating a previous surgery for cleft lip and palate when he was just 1 year old. During anterior rhinoscopy, they observed a whitish structure in the floor of the nasal cavity, located very close to the inferior turbinate, approximately 15 millimeters deep from the nostril margin. This object felt hard upon palpation, and there was granulation tissue surrounding its embedded portion. Additionally, they noted a deviated nasal septum on the same side. Dental examination revealed a complete dental formula suitable for the boy's age, although the teeth were malaligned. X-ray imaging of the paranasal sinuses showed a radiopaque mass resembling a tooth within the right nasal cavity. Further panoramic radiography confirmed this finding, showing a tooth with a crown positioned horizontally in the right nasal floor. CT scans also confirmed the presence of this unusual intranasal tooth. A diagnosis of a supernumerary intranasal tooth was established, and the medical team opted for extraction under general anesthesia. The procedure was successful, with the removal of the abnormal tooth, which included the radix, cervix, and crown, measuring approximately 12 millimeters in length. The extracted tooth was white in color, with most of the cervix and radix covered by mucosa or granulation tissue. Importantly, no residual fistula was observed within the hard palate or the floor of the nasal cavity. The patient was discharged the following day, and his postoperative recovery remained uneventful. This curious case serves as a reminder that even the most unusual medical mysteries can find answers with the help of modern medical technology and expertise. Our second enigmatic case introduces us to another 12-year-old boy who presented with a peculiar set of symptoms that had been troubling him for 3 years. He complained of right-sided nasal obstruction, occasional foul-smelling blood-stained nasal discharge, feelings of fullness, and recurring headaches. On examination, the right nasal cavity exhibited granulations and excessive crusting, raising concerns about the underlying cause. Dental examination further heightened suspicion, as it revealed the absence of the right upper lateral incisor tooth. This discovery prompted the medical team to consider the possibility of a forgotten foreign body or ectopic tooth. To gain a clearer understanding of the situation, they ordered a non-contrast CT scan of the paranasal sinuses. The CT scan revealed the presence of a tooth-like structure in the floor of the right nasal cavity, accompanied by right maxillary sinusitis. With this critical information in hand, the medical team decided to proceed with the extraction of the ectopic tooth under general anesthesia. During the procedure, after removing the granulation tissue and crusting, they found the tooth lying loosely in a horizontal position, nestled between the inferior turbinate and the floor of the nasal cavity. The extraction was completed successfully with the guidance of an endoscope. Notably, no fistula was observed in the floor of the nasal cavity after the tooth's removal. Additionally, the medical team performed a maxillary antrostomy to clear the retained secretions within the maxillary sinus. The extracted tooth had a pale yellowish appearance, a hollow cavity, and measured approximately 10 millimeters in length. This case serves as a compelling example of how seemingly unrelated symptoms can lead to the discovery of an intriguing medical mystery and its subsequent resolution through medical intervention. In our third and final enigmatic case, we encounter another 12-year-old boy presenting with a right-sided facial swelling and the presence of a fistula on his cheek, persisting for 6 months. His medical history also included a traumatic incident in the same area approximately 1 year earlier. Clinical examination revealed not only fullness of the right cheek, but also pain and swelling around the fistulous tract. When pressure was applied to the cheek, yellowish serous fluid was expressed. Further examination revealed that the right maxillary central incisor tooth was loose and discolored, while the lateral incisor tooth was missing. This combination of symptoms and findings prompted the medical team to explore the possibility of an ectopic tooth within the maxillary sinus. A non-contrast CT scan of the paranasal sinuses was ordered to provide more insight into the condition. The scan revealed a well-defined expansile, lytic cystic lesion within the right half of the maxillary sinus, with the crown of an impacted tooth clearly visible. Additionally, there was evidence of cortical breach at the lesion's lateral aspect, along with thickening of the skin and soft tissues, including the bulky buccinator's muscle. During the surgical procedure, the medical team completely excised the fistulous tract and obliterated the sinus opening with muscle. The cheek skin was sutured, and the patient's postoperative recovery was uneventful. Remarkably, there was no recurrence of symptoms during the 2 years of follow-up. This case underscores the importance of considering various potential causes for complex medical presentations, as well as the efficacy of surgical intervention in resolving intricate medical mysteries. Now, let's broaden our understanding. Supernumerary teeth are not an everyday occurrence, with an incidence rate ranging from 0.1% to 1% in the general population. However, in the Indian subcontinent, this rate increases to a remarkable 2.5%. These teeth typically reside within the upper jaw, either near central incisors or, less frequently, near third molars. What's intriguing is that supernumerary teeth, particularly those of an ectopic nature, may exist in unconventional locations, such as the nasal cavity, mandibular condyle, coronoid process, orbit, palate, or even the maxillary sinus. While they often remain asymptomatic, they can disrupt normal teeth, causing malalignment and other complications. The etiology of supernumerary teeth remains a subject of investigation. Several theories suggest their development from dental lamina abnormalities, hyperactivity of dental lamina, epithelial mesenchymal interaction, genetic factors, or obstructions during tooth eruption due to crowded dentition, persistent deciduous teeth, trauma, cysts, or infections. Symptoms associated with ectopic teeth include nasal obstruction, foul-smelling rhinorrhea, crusting, localized ulceration, nasal congestion, epistaxis, and foreign body sensation. Complications can range from rhinitis caseosa to nasolacrimal duct obstruction, septal perforation, and oronasal fistula. Ectopic maxillary teeth, on the other hand, may manifest as sinusitis, headaches, cheek swelling, epiphora, or even oroantral fistulas, an extremely rare presentation. Sometimes, complications lead to the discovery of the ectopic tooth, further complicating the diagnosis. Intriguingly, our first case involves a child who had undergone cleft lip and palate repair at a young age. The tooth's presence in the nasal cavity was overlooked at the time, likely due to the child's incomplete dentition and mental retardation. Over time, the tooth's asymptomatic nature led to negligence until it became a cause for concern. The second case showcases the importance of dental examination. Missing upper lateral incisor tooth raised suspicion, eventually leading to the discovery of the ectopic tooth in the nasal cavity. When it comes to treatment, surgery remains the go-to option for removing ectopic teeth in the nasal cavity. However, there's an important caveat. It's often advisable to wait until the patient's permanent teeth have erupted, unless complications arise. Periodic radiographic examinations are crucial to monitor the tooth's impact on the surrounding tissues. Extraction procedures can vary, but the key is to ensure a safe removal that minimizes the risk of injury and complications. In transitional teeth, these mysterious dental oddities may be rare, but they remind us that even within our own bodies, the enigmatic wonders of science continue to astonish and perplex. As we conclude this tale of teeth where they shouldn't be, we urge you to subscribe to our channel and stay tuned for more captivating scientific mysteries that will challenge your perception of the world around you.